I'm here with Dr. Sherri Worth today, and we wanted to talk about dental anxiety and the fears that people have about going to visit your dentist. So tell me what's going on in your practice today.
You know, it's interesting that you asked, because in the past, I'd say 5 years or so, maybe more, we've seen a dramatic increase in dental phobic patients. You would always see them throughout the years, and even more so when I first started practicing, because then young kids they would hold them down to do dentistry and they would have horrible experiences. Now the pediatric dentists have so many tools that make the kids happy. There's no pain. Our anesthetic is good. The toys, the fun, the practices are like going to a toy store, basically. So those kids are conditioned, and they really have a great way of getting the kids to have fun at the dentist so they're not afraid of it later on. However, for some reason, I've had a great influx anywhere from the age of 20 to say 80 who are incredibly fearful of the dentist. And I don't know if it's people who have just neglected their teeth because they've had a small bad experience and then it's gotten exponentially worse. I'm not too sure what it is. So it's caused us as a profession to dive in further and figure out how can we make these people happy. And what we've done at the Center of Reconstructive Dentistry is we've really put our feelers out. We've tried to figure out the best way, but we've come up with a systematic approach that allows the patient to come in, get comfortable with the office, really feel like, okay, this is the place I want to be. We start out with tiny little things. We also offer IV sedation, which is like a little twilight if you've had your third molars removed, or you've had a colonoscopy. It's the same type of anesthetic or anesthesia that's light, so you can go on and function afterwards. What that does is completely take the fears away. And we also have nitrous, which has been a tool that we've used for years. But I think the IV sedation has really changed the face of dentistry when it comes to fears. And IV sedation, coupled with the systematic approach we have to kind of desensitize these patients of their fears, has been very successful over the last few years.